This is a web-based instruction for scrub nurses and doctors in urological care. Doctors for Africa and other organizations provide urological care in African hospitals. The purpose of this lecture is understanding of the different parts of the instruments. I'll explain the vulnerability. These instruments are extremely expensive. I'll also explain cleaning and disinfection. BPH, or benign prostate hyperplasia, is common in male. TURP stands for transurethral resection of the prostate. It is performed with a tube through the urethra into the prostate. A small metal wire gets very hot by diathermia. In this way, you can remove small chips from the prostate. Goal is to create a cavity so voiding is possible again. The principle of transurethral resection. It's the introduction of the tube, the receptoscope, and you can see through the telescope or ocular. There is need for continuous irrigation of the fluid to keep the urethra and prostate open, rinse the blood. In this way, you can keep clear vision. On the instrument, there is a valve for inflow indicated by an arrow at the instrument. There is also a valve for outflow. This is an example of a continuous flow instrument. Continuous flow can be obtained by placing a suprapubic catheter that is used for continuous outflow of the irrigation fluid. But with this typical instrument with the continuous flow, you have inflow through the tube and outflow through the small holes you can see at the tip of the instrument. In this way, you do not need to place a suprapubic catheter. With the small semicircular wire at the tip of this instrument, you can heat up and resect the tissue and coagulate the bleedings. At the end, the resected chips need to be removed through the instrument using a special syringe. This is an overview of the instruments needed for the transurethral resection. Number 1 is the light cable that is plugged into a light source. 2 is the cable for connection to the special diathermia machine. 3 is the connector for the use with the non-continuous flow. 4 is the outer shaft for continuous flow. 5 is the inner shaft. 6, the obturator to close the tip and enabling an atraumatic introduction into the urethra. 7 is the working element. 8 is the resection loop. 9 is the ocular or the telescope. 10 is the glass syringe we use for removal of the resected chips. 11 is the plunger for the syringe. And 12 is the visual obturator, also known as the Schmidt instrument. The working element comes in 2 types. The principle is that by moving the small ring with your thumb, the resection loop electrode will be moved in and out of the opening at the tip of the shaft. In rest, the top one has the electrode inside the opening, so you have to actively push it out of the tip into the tissue. The lower one is called the active type. It has an A configuration. In rest, the electrode is out of the shaft. To resect the tissue, you need to pull the small ring towards you. The choice for use of either one of this is by the doctor. Here is a video of the materials. This is the outer shaft with the valves. This is the inner shaft. All parts can be put together and you hear a click. This is the obturator. After inserting, the tip of this instrument is blunt, so you can insert it without trauma. This is the loop or electrode, which is very vulnerable. This is the working element with a small channel that is used to introduce the loop. And by moving it in this way, you move the electrode. Introduction of the loop into the lesser tube. You also hear a click. Always check if it's firmly attached. Then we have the telescope that goes into the larger tube in the working element. There's a small opening. Introduction must be done very careful. Don't bend the telescope. It's very vulnerable. You also hear a click. Then the attachments for the electricity. There's a specialized cable which is foolproof. The female part goes on the top. And there is a male part. The light cable connector. Is screwed on the working element. After removal of the obturator by pushing the button and pulling it out, the doctor will insert the instrument into the shaft. The direction of flow of the irrigation fluid is correct. This is the glass syringe to remove the chips. Of course, this is very vulnerable. It's quite tight too. You have to screw it with care and without force. The small part can be used if the outer shaft is not used. That is to reduce the diameter of the instrument if you have an urethra that is not so wide. Aftercare. Once again, the material is very vulnerable. If they fall, it will be damaged. If you put something heavy on it, it will bend. After the procedure, take everything apart and open all valves, because the sterilization fluid must reach all inner parts. Do not forget to take out the inner shaft. There is always some blood in between the inner and outer shaft, and that must be removed. Rinse everything with water and a soft brush. Be careful with the glass syringe. Read the instruction for the sterilization fluid and adhere to the minimum and the maximum time you put the instruments into this fluid. The instruments might either be not sterile enough or they will get damaged by the aggressive fluid. Leave the part of the cable that goes into the diathermia machine out of the sterilization fluid. All instruments are made of metal, but it's all thin-walled. If it bends, the parts will no longer fit. If the ocular or telescope bends, you cannot see through it anymore. At the end of the day, see to it that you dry all instruments and especially the syringe and the plunger. Otherwise, there will be corrosion on the metal part and the plunger will not slide into the glass easily anymore. You might add some silicone oil to it. Please take notice, we only have one set. If it fails, we cannot proceed with the mission. The total cost for the instruments, excluding the diathermia machine, is approximately 200,000 Ghanaian cedis. So we rely on everyone to take good care of the instruments, both doctors and staff. If you have any questions, please ask. In this way, we can make our missions a success by cooperation. I thank you for your attention. Once again, if you do have any questions, don't hesitate to ask. Your staff members have easy connection to our organizations, so if you do have any questions in advance or after the missions, don't hesitate to get into contact with us. Thank you for your attention.